While the American healthcare system is staffed with some of the most skilled and compassionate providers in the world, its complexities lead to unavoidable flaws. The most vulnerable populations, like people who are over 65, those who are economically disadvantaged, and people who are affected by social factors like poverty, food deserts, and poor access to preventative care, are more likely to have poor outcomes. For over 40 years, IPRO has been working to address these complex issues.
The work we do is important and impactful. We work with healthcare providers to make care better for all people.
The culture at IPRO, it stems from the fact that we are all working towards the same goal, and that goal is to improve healthcare, whether it's with Medicare beneficiaries or Medicaid beneficiaries. It doesn't really matter, because when we work with providers, we work to improve their systems of healthcare delivery. And the bottom line is that is what we are focused on, and we're all rowing in the same direction, and it feels good because you don't often find that in life.
Alongside state and federal governments, providers, payers, and patients, IPRO helps design and deploy programs that improve the quality of care given to Medicare and Medicaid beneficiaries. IPRO's team of quality improvement specialists, data scientists, public health experts, clinicians, and many others find creative solutions for our healthcare system's most challenging problems. From its humble beginnings with 32 employees in a small office in Rego Park, Queens, to its current role as one of the nation's leading healthcare quality improvement organizations, IPRO Story is one of steady growth, progress, and the enduring commitment to its mission. In 1984, the company that would become IPRO was created. Known as Island Peer Review Organization, it held contracts with the federal government to perform peer reviews on providers in Nassau and Suffolk counties. 3 years later, IPRO opened its Albany office and became a statewide Medicaid review agent. 1989 was a pivotal year for IPRO. IPRO received a large federal contract that year. That same year, IPRO received its first external quality review contract with the state of New York. Through this work, known as IPRO, IPRO helps states monitor the care received by those covered by Medicaid managed care organizations. By 1991, IPRO had outgrown its headquarters and relocated to Lake Success, New York. That year, the company successfully bid on the New York State AIDS Management System contract, which it continues to hold today.
IPRO was about this, not quite the same size that it is now, but there was this feeling of the need to work together, and we achieved a lot of common goals.
IPRO reached another significant milestone in 1997, winning independent review organization contracts with a number of states across the nation. By 1999, IPRO had carved out expertise in health informatics and data analytics, creating the New York State Health Accountability Foundation, which published the first statewide HMO report card. As a quality-focused organization, IPRO is committed to its own internal standards of performance. Toward that end, in 2000, IPRO became one of the first companies to earn accreditation from the Utilization Review Accreditation Commission, or URAC. 2001 was a momentous year for IPRO. The company was selected by New York State to help monitor both its early intervention program and its medical resident work hours initiative. Then in September, tragedy struck the nation as 2 planes flew into the World Trade Center in a horrific terrorist attack.
When 9/11 happened, we pulled together an emergency response site here within about 4 hours. And the 800 number here, we had AT&T, we had the training room set up, and it was such a pull together from all the different people, and that we wound up being the emergency response site for the New York office, for CMS. They were so impressed with what we pulled together. And just that, again, it's that camaraderie. You cannot buy that.
The early 2000s saw IPRO expanding its portfolio to state EQRO clients. In 2006, the company won its first end-stage renal disease, or ESRD contract, forming the IPRO ESRD network of New York. Today, IPRO manages 4 ESRD networks, adding New England, the South Atlantic region, and the Ohio River Valley to its roster. IPRO ESRD staff collaborates with dialysis centers and providers and advocates on behalf of end-stage renal disease patients to ensure that they have access to the highest quality care, including transplantation.
I think one thing that we have come a long way on is involving patients or beneficiaries or families in our work. It wasn't always something that was top of mind or a huge priority when I started 20 years ago. Our contractors have been asking us to do it, and it's especially important in our end-stage renal disease program. And I think Katrina, when that happened, our contractors and our staff and our advocates realized how important patients were to helping us solve problems. The understanding of what patients go through really helped us do a better job in improving quality.
In 2017, IPRO rebranded and adopted its current logo and tagline, Better Healthcare Realized. This slogan embraces IPRO's mission to be a trusted partner to state and federal agencies working to measure and improve healthcare for all. In 2019, IPRO was selected by the Centers for Medicaid and Medicare Services to be a Quality Innovation Network Quality Improvement Organization, or QIN/QIO, for 11 states and the District of Columbia. At the same time, IPRO works as a subcontractor on this contract in an additional 7 states. Through this work, IPRO is focused on improving the quality of care provided to more than 20% of the nation's Medicare fee-for-service beneficiaries in nursing homes and in the community setting. In 2019, IPRO also became a Hospital Quality Improvement Contractor, or HQIC, in 12 states. One of the most significant challenges IPRO has faced, along with its colleagues across the healthcare continuum, has been the COVID-19 pandemic. Once again, IPRO was called upon to respond to an unprecedented national emergency, and its employees answered the call. Nursing homes were hit particularly hard, and IPRO's quality improvement teams helped them develop and implement infection prevention protocols, resident cohorting plans, visitors policies, and vaccination campaigns. Meanwhile, IPRO's data analytics team worked feverishly with the New York State Department of Health to analyze and publish data on the earliest studies of the potential treatments for this previously unseen virus.
Things that we were most proud of during the pandemic that we did in the early phases was to assist the state in a drug study on hydroxychloroquine to help understand and know which drugs were actually helping and which ones, just as importantly, were not helping. So we got quickly pivoted on a dime to stand up our part of this study in receiving and collecting records to analyze hydroxychloroquine and see if it was turning out to be useful in the hospital setting or not. And we ended up getting published alongside the Department of Health with our findings. Turned out hydroxychloroquine was not helpful, but it was because of our effort to quickly stand up our data collection team, our nurses, and rapidly move through those charts and understand what was working and what wasn't, and that helped in an early, important phase of the pandemic to better understand what was going on.
In 2021, IPRO launched its Center for Program Evaluation. The center is staffed by a team of research professionals, including data scientists, clinician researchers, epidemiologists, biostatisticians, experts in health policy, implementation science, and quality measurement, as well as systems analysts who perform insightful evaluations of healthcare across the spectrum of settings. This was followed 2 years later by the formation of the Center for Performance Measurement. This team has deep subject matter expertise in Medicare, Medicaid, patient experience, sepsis, performance improvement, and more. In 2022, IPRO became one of the first organizations to be certified as an independent dispute resolution entity under the federal No Surprises Act. Through this work, IPRO helps protect consumers from surprise medical bills by mediating disputes between health plans and providers. 2024 marks IPRO's 40th anniversary. Today, the company employs 350 professionals, including
accountants,
data coordinators,
contract managers,
registered nurses,
cloud developers,
data analysts, corporate programs managers,
and healthcare communication specialists. IPRO also retains a network of more than 300 board-certified physician consultants. Its growth and success has been thanks in large part to the guidance and support of an active and engaged board of directors. In addition to its Jericho headquarters and Albany office, IPRO maintains offices in Hamilton, New Jersey, and Beechwood, Ohio, working in all 50 states, the District of Columbia, and all U.S. territories. IPRO continues to evolve to meet the ever-changing needs of the healthcare system, always looking ahead. Today, IPRO is undergoing a digital transformation that will prepare the company to continue its role as one of the nation's leading healthcare quality improvement organizations.
Watched IPRO grow and evolve into a highly regarded healthcare quality improvement organization, really with a national footprint. It's so gratifying to know that IPRO has impacted millions of lives by improving the quality of care delivered to our most vulnerable populations throughout the country.
I think the IPRO of 10 years from now will have the same mission at its core, that focus on people and improving healthcare for them.
We've reached this point only because of the hard work and dedication of the entire IPRO team. We'll continue to dedicate ourselves to this work because we know we are making a difference and improving lives.